So I'm just going to also run into a discussion on labor management. So if you ask a mother, in fact, you ask yourself here, what is your biggest fear in the entire pregnancy? It must be the delivery day itself. I think most mothers told me that they're worried of the labor day, and the biggest worry is pain. So pain is a very real concern in the labor. Unfortunately, I haven't delivered before. I can't share with you, but I've delivered many mothers before, and many of them share with me that the pain is extremely intense. In fact, if you were to look at some of the research on the pain of the labor pain, it has been said that the labor pain is 10 times worse than that of a toothache. And you know that toothache, when you get one, is almost dying. So labor pain intensity is 10 times worse than that of the toothache. So you can see that labor pain is very intense. But on the other hand, labor, the pain threshold of every woman is different. I respect many of my mothers whom I have delivered. Many of them are very stoic. In fact, some of them virtually had no pain management and they deliver without any pain management. But some are also very fearful of pain. So let's see what are the ways that you can use to ease your labor pain, not necessarily resorting to medication. So rhythmic breathing has been shown to be one of the most effective way to control breathing at this junction. And we like to usually we like to train you before the D-Day itself that you like to take slow breath deep in during your contraction to focus on the breathing rather than the pain itself. So big breathing, deep breathing, and exhale slowly, and then alternate with shallow breathing as well. So this will reduces endorphin, and by concentrating your attention on breathing rather than pain, it takes your mind a lot from the pain itself. So this is actually very important, rhythmic breathing. Your partner, your husband is very important or your partner is very important for you in this junction. So your partner can help use the massage, keep you calm, join the breathing technique as well. But one thing I have to warn you, husband, if you're here, that your wife will be very depressed, very distressed during the labor because of the pain itself. So nothing you do will be right. You get scolded. I see many husbands get scolded. Even I get scolded sometimes by the patients as well. So do understand that they're going through a very difficult process, and please help them out to ease the pain. So you can massage them or gently stroke them with some essential oil or massage oil. Talking about essential oil, some women are very good at aromatherapy. In fact, some of these will help the woman to relax. Actually, it helps me to relax as well. So sometimes I really like to go to the labor room when they play, when some women play very nice jazz music. So whatever music you feel comfortable, sometimes you may want to bring your own pillow or your own blanket so that you feel that you're at home, so that you actually feels more comfortable. Heat pack might be important. Water bath is actually a consideration that some patients love to do. And water bath have been shown in the first trimester, first stage of the labor to relieve pain so that there's no need for epidural. So water bath is actually used as an alternative to epidural. But we do not actually deliver the baby in the water. Usually in the second stage when you're pushing, you usually will be out of the water and not actually doing the delivery in the water itself. So that is sometimes a misnomer. Gas is important. So sometimes we give nitrous oxide. This is also known as laughing gas. In fact, I usually ask the husband to try as well so that they can be relaxed. So it actually causes you to be a bit lightheaded and helps to reduce the pain. Next is pethidine injection. It's a very powerful opioid injection that can reduce pain, but usually we can only use this in early labor and not the late stage of labor because it does cross the placenta and it can cause respiratory distress for the baby. you ask me what's the best invention for women in the last century, is probably not the Hermes handbag that has been invented. Is probably epidural. Epidural has reduced the pain of mother's pain by tremendous. It can almost reduce the pain to zero. In fact, if woman is very fearful of pain, I would then advise you to take epidural. There's a big misnomer that epidural causes paralysis. It does not. And it sometimes can cause some back pain, but this is transient. Usually in about 3 to 6 months, you will recover, or sometimes even the next 1 to 2 weeks, you recover from the back pain. It can also cause headache due to a dural puncture as well. So, but usually this is also will recover in the next couple of days as well.